Welcome to Friday Night Live. I am your host, Kat Carter. How are you doing today? It is Friday. We have made it through another week. I am so grateful and I'm thankful that you are here to hang out with me this evening because I have a wonderful lineup. Both of my guests are returning guests. Yes. And so stay tuned. We have Mr. Bob Marovich coming up. He is the founder and editor-in-chief of the Journal of Gospel Music. And then later we're going to be doing some preventative measures with Dr. Ronald Rembert Jr. So Friday Night Live is a positive platform where we come to inform, innovate, and inspire. So I'm going to do something a little bit different for encouragement. You know, I've been singing a lot of hymns lately. I guess I've been dealing with a lot of things. And so my auntie Ada sent me this beautiful hymn, and this is going to be our encouragement for this evening. I hope that you enjoy it. It's called Shine on Me from Auntie Ada. Shine on me. Uh-oh, hold on a second. What happened? Shine on me. Shine on me. I wonder if the lighthouse will shine on me. Shine on me. Shine on me. I wonder if the lighthouse will shine on me. I heard the voice of Jesus saying, come on to me and rest. Lie down, thy weary one, lie down, thy head upon my breast. Shine on me. Shine on me. I wonder if the lighthouse will shine on me. Shine on me. Shine on me. I wonder if the lighthouse will shine on me. Thank you, Auntie Ada. Shine on me. Did you all enjoy that? I know Bob enjoyed it. He's coming up right now. Auntie Ada did our encouragement corner. Shine on me. Yes. Okay, so let me tell you about Bob Marovich. Okay, Grammy-nominated Arthur Autumn Notes, The Gospel According to Malachi, 2019. 2016 recipient of the Certificate of Merit in Historical Sound Recorded Research from the Association of Recorded Sound Collections. And this is from his book, A City Called Heaven, Chicago and the Birth of Gospel Music. Also recipient of the 2018 Rhythm of the Gospel Award for Gospel Radio Show of the Year. Yep, he hosts the Gospel Memories radio show in the Chicagoland area. Please welcome to Friday Night Live. Welcome back to Friday Night Live, my good friend, Bob Marovich.
Hey, Lady Cat Carter. How are you?
Hey, how you doing?
Good, good. After Auntie Ada sing, I just wanted to say, let the church sing amen.
Amen. Yes,
Amen. Yeah.
yes. Let us say amen. Amen.
Awesome. That was great. That was great.
Yeah, that was really, really good. Bob, I've been doing hymns like lately, just like those older hymns, like the ones that I kind of grew up with. And, you know, I was singing that song, but I couldn't remember the verse. And then so I put it on Facebook and I was like, I can't remember the verse. And the next thing I knew, my auntie just sent it to me to my phone and I just started it was just a great movie. And I just started crying and it was a great release for me. So I wanted to play that. Yes. Yes. I am so excited that you are back. You know,
happy to be back.
Yes, sir. And I have been watching you on Facebook. It's been some wonderful things happening since the last time I saw you.
Thank you.
Yes.
Yeah, quite a few things. Yeah, it's a lot of things have been in the process for a while, but all kind of coming together at the same time.
Wonderful, wonderful. Well, you know, we got to start this off. I have got to see that award that you got.
Oh,
I have to. You got to tell us about it. Tell us how happy. Tell us.
So this is the Rhythm of Gospel Award. This went to the Journal of Gospel Music Gospel Internet Promotion and Marketing Group of the Year.
Beautiful.
And so I got this from the Rhythm of Gospel Awards. It was great. It was in Memphis this year at the Graceland. Well, it's called the Guest House at Graceland. So it's a hotel near Elvis Presley's house. It's the second Rhythm of Gospel Award, as you mentioned earlier. I got one for my radio show. So this is for the website. And, you know, I can't not point out that I also got this. This is the Hall of Fame Award from the Gospel Industry Network, which is brand new. Hall of
Oh,
Fame
wow,
award for
that
being a
is
gospel
beautiful.
historian. So yeah, some good stuff. Some good stuff happening. Thank you.
Congratulations, congratulations,
Thank you.
congratulations. Do you have like an award plaque, award cabinet or something in there to put that stuff in? I mean, you
I
might as well get one.
don't. It's unfortunate I don't. It's sitting. I have this old wind-up Victrola that I bought like in the '90s, and
Mhm.
so now it's been sitting on top of that. So I can't actually open it up and use it because everything's sitting on top of it. But that's my makeshift trophy case right now.
Oh, wow. Well, Bob, I think you're gonna have to get a cabinet. You're starting to get whole lot of recognition and stuff. You gotta have some place to put all those memories. That is just wonderful, and those accomplishments. That's
It's,
wonderful.
thank you, thank you. Yeah, no, it's the grace of God. It's hard. Who knows who he's going to pick to do his work? And 25 years ago, if you had said you're going to do all this, I would have said I can't imagine how I could possibly do it.
Right.
But 2001 changed everything. That's when I started the radio show and really started moving into what I'm doing now.
Yeah, yeah. Okay, so the last time you were here, we were talking about a book that you had out. It was A City Called Heaven. You remember that? And we
Yes.
talked real. Now you have some brand new stuff coming up that I'm just really excited. I can hardly wait. And I know one of the projects is going to be available like real soon. And then you have something that's already available. So I'm going to let you kind of talk about it how you want to, and let you just go your own way and give us information about that.
Oh, sure. Yeah. No, I'll tell you about the one that's coming out in November 21st first, because that one is actually kind of gave birth to the other.
Okay.
About in 2013, I did a program on the 50th anniversary of the Peace Be Still album, the James Cleveland and the Angelic Choir, Peace Be Still, where I believe they sing Shine On Me on that recording.
Are you
Um,
serious?
yes, I think it's the first track on side two. They all sing it together in unison. And in any event, I did a 50th anniversary broadcast on my radio show, but I got to talking with the daughter of one of the choir members, Reverend Dr. Stephanie Minity out of New Jersey. She has a group called Jubilation.
Mm-hmm.
And so long story short, we got the idea maybe I should write a book about Peace Be Still. Never had planned to do it. There you go. Did perfect right there. Not at all in my thinking at that time. I just wanted to do the radio show, but
Mm-hmm.
fast forward, Reverend Steph set up where I could interview some of the original Angelic Choir members who were there at that recording, and went down to First Baptist Church of Nutley, New Jersey. Met him in the basement. We had a great conversation with about a dozen of the original members, and it just took off from there. So starting in 2013 to this year, I wrote this book. And I really did it too to just kind of give a sense of what gospel music means. So much of the stuff I'd done was historical, and it was the facts and what happened and who was involved and
Yeah.
where it was involved, but about the music itself and what it means. And Peace Be Still has sometimes been seen as, well, was this kind of a civil rights song? And the choir members did not see it that way. This was an everyday song for the choir members.
Mm-hmm.
This was just getting through every day in Newark, New Jersey, where there was plenty of enough discrimination going on in different areas for them to feel as if this was a personal story. So that was the beginning of that. And then I was at Malaco Records in 2017 or 18, whenever that was, 2018. And we
Mm-hmm.
were working on the Gospel According to Malaco that I got the Grammy nomination for.
That
And I
is
was
so awesome.
and I was telling Tommy Couch Sr., who is the CEO, about Peace Be Still, because Malaco owns the licensing for that. That's a Savoy product, and Malaco owns the licensing for Savoy.
Mm-hmm.
And over the couple of days I was there doing research, he said, well, maybe we should do a James Cleveland box set.
Yes.
And so, 2019, he called me, and Tommy Jr. called and said, let's do this. And let's do it just like the Gospel According to Malaco. Let it be like 100-page coffee table book with photographs, really tastefully done, the
Mm-hmm.
history of James Cleveland, his music. And so what just came out on Tuesday is the King of Gospel Music, the life and music of Reverend James Cleveland. And that follows his music from 1951 when he made his first record,
Hmm.
to 1990, his last recording session.
Is that
And
the other slide that you sent me? Is that the other one?
that's the other one. Absolutely. And
There it is.
yep. And that's it. So it's 100 pages or so, a little over 50 tracks. We had to pick out about 115 tracks, but we
Wow.
had to cut it back because of, you just can't put that much music on 4 CDs.
Yeah.
But we tried to pick the best. And talking about the music and how Reverend Cleveland used musicians and singers and sort of peppered in his life story. I had a chance to speak with his sister, who is still
Mhm.
alive, and a number of the musicians. And so, yeah, it really came out to be a nice, very uh, brief but important history of Reverend James Cleveland, who really has not had a full length project dedicated to him yet.
I think you're right because I was doing a little research. I know who he is, but since you
Mhm.
were coming, I had to do my homework and I didn't see that. So yeah, this is going to be, uh, oh my gosh, this is going to be one for the books for real. This project coming out with all of, did you say 4 CDs of all of
Four
his music?
CDs. Yeah. So it starts, with him, and he was, gosh, 1951. So he was just 20 years old. Not even, I think he was 19 when he made his first record with a group called the Gospel Airs, which were members of the Roberta Martin singers. He
Mhm.
idolized Roberta Martin, and he was able to persuade a couple of the Roberta Martin singers to join him in a group. They didn't last very long, but they made some records. They toured around, and then, the members went back to the Roberta Martin singers, and James went on. He worked with the Caravans. He worked with the Voices of Tabernacle. He had his own group called the Gospel Chimes. He worked with the Gospel All Stars.
Wow.
Then he worked with the Angelic Choir. And then, of course, started the Gospel Music Workshop. And then
Mhm.
his James Cleveland Presents project, which a lot of the tracks come from, was him introducing people to the industry, saying, "I'm James Cleveland. I can get you on Savoy Records. We'll make a record with you. We'll call it James Cleveland Presents, Lady Cat Carter and the Voices of Deliverance. I'll sing with you. And then if it does well, we'll make a second record and it'll just all be yours." So
Right.
there was that went on for, gosh, 1969 to into the 80s. Um,
You know what? When I was in radio back in the 2000s, I was Gospel Music Workshop of America Announcer of the Year for 2003.
awesome.
And I have it and I never connected the dots until you just said that. But
That's
yeah,
a great
I have
honor.
I have a book with all
Congratulations.
of my things, and they had me like in a little, like a little circular little, my name and the
Yeah.
radio station that I worked at, and yeah, I think it was 2003. That was it, and I wonder if that ties in with because he was a Gospel Music Workshop of America. So
Oh,
I'm
yeah.
just connecting the dots just by talking to you. Wow, that's just really amazing.
Yeah. He started the Gospel Music Workshop of America in 1967, and then added on the Gospel Announcers Guild.
Yeah,
And that's where the Gospel Announcer of the Year, it might even been the Willie McKinstry Award or something like that. But
yeah,
yeah, I mean, that's a great honor. That's a top honor. That's like getting the Stellar Awards Radio Announcer of the Year. That's terrific.
I was really excited then.
Yeah.
Yes. Wow. So, this is is this the last Friday of the month? Is this the last
It
Friday
is.
of the month?
It is.
So on the last Friday of the month, Bob, we usually give a prize away at least $50. And so I know that that package right there that you just talked about, what's the retail of it?
It's $59.95.
So we're going to be giving one of those away. Do you have one with you so we can kind of to open up and show it?
I don't have one. You know what? If
I
you
know
take
you
me
had it.
if you take me off screen, I'll go run and get one.
Okay. Oh, wait.
Take me off screen, and I'll go get one.
Okay, I'm going to take you off screen. Okay, he'll be right back. I know he has it because he showed it to me. Did you all enjoy Auntie Ada? OMG. She sent that to me and I just boo-hooed and boo-hooed while we were waiting. Oh, he came back. I was about to do some shout outs. Let me see.
Yep.
There he
So
is.
here it is. It's so 4 CDs in the back. Let's see. So there's the 4 CDs, and let's see if I can do this. Yep. So there's the 4 CDs, and then it's just it's like like a coffee table book with pictures and
Those are some really nice,
reminiscences.
beautiful, colorful pictures too.
Yeah. Oh, Dennis Heckler is the music or the artistic director, and he just really puts together a good project. So it's something you can read, you can kind of flip through. There's again, then there's the different songs that are on it. It's actually interesting. There's at least one example on here that is an extended version. There's a song called "Get Right Church" that
Get
James.
right, church, and
Yep,
let's go home. I know
that's
that
it.
song.
Well,
Hmm.
we didn't realize until we got this put together that the version on here is longer than the single, because they licensed the song from Hob Records, and Hob gave them the original tape, and it ran longer. They obviously cut it for radio, I suppose, for the
Yeah,
single.
the radio. Yeah, the
Yeah,
radio edit. Hmm.
but it's actually the full length. And Kirk Franklin did the forward. So
Oh,
it's Kirk Franklin did the forward, and some of the people who responded. Warren Campbell wrote something about this. Evangelist Dorothy Norwood, Pastor Shirley
wow.
Seeger, Dr. Milton Bigham. So yeah,
Oh,
so some good folks have endorsed it.
yeah,
So
those some heavy hitters.
yeah, and it's great because it talks about James going through from really traditional. I mean, he's the bridge between traditional and contemporary music.
Hmm.
He didn't ever want to lose that traditional feel, but he always brought the music forward. And so the Gospel Music Workshop of America really helped to develop the contemporary artists that we know today. I mean, Kirk Franklin he actually participated in the Gospel Music Workshop, never met James Cleveland, but he was there.
Hmm.
But, Yolanda Adams, Kurt Carr, um, a lot of the current artists have gone through the workshop and learned that contemporary style and developed their craft under Reverend James Cleveland's leadership.
I have a good friend on here. He's actually a radio announcer too, and he does show on Facebook. So I want to send a shout out to him. His name
Yeah.
is Jazzy Ward. He's hanging out. So definitely want to anybody out any radio people since you're here. Want to
Yes.
make sure I want to Jazzy Ward is on here. Awesome. I got a chance to listen to his show yesterday. Really, really great guy. He has a
Very
great
cool.
show. So I wanted to make sure I let you know who he is.
Yes. Hello,
Yeah,
Jazzy.
you gotta get on his show. He does interviews as well.
Perfect. Perfect.
Yes, yes. So I'm gonna send him your information so you can get
Thank
on
you.
there. Yeah.
Thank you.
Hmm.
Yeah. So I'm
Okay.
excited. This is a James Cleveland would have been 90 years old this December. So it's good that everything's
90?
happening. Yeah.
Wow.
So yeah, I think this is a good time to be putting out materials about him, and I know there's more people doing work on him that far exceed what we're doing now. So I'm very pleased to have been a little bit of a part of this with Reverend Cleveland, and I hope people enjoy the project and the book. And I mean that's the best I can. Yeah, that's really what I want to hope for.
Yeah. So it just came out, guys, September the 21st. So if they were interested in purchasing it, because I'm only giving one away. So
Mhm.
anybody that's interested in purchasing it, where can they purchase this at?
Best and easiest is Amazon. I know you
Okay.
can go to malico.com, but you can also go to Amazon and they have it all set up and ready to go. And in fact, it's in terms of the new gospel releases of books, it's number one. So people are really, people love James Cleveland. They love Reverend Cleveland and all he's done,
Yeah.
and
Yeah.
people are really enjoying this. So you'll get it quickly too through
Hmm.
Amazon.
Pastor Neil is on here. He's a pastor in Chicago, True Christian Fellowship,
Ah,
and he also plays the music, the keyboard, and he says I played many of his songs growing up. Yeah.
yes, and Reverend Cleveland was born in Chicago, lived in Chicago for a long time. So yeah, I'm sure many of those songs were born right here.
Yes, 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 yes. Oh my goodness. So, I'm trying to figure out what else. What else would you like to talk about? That right there is like a major thing. The Reverend James Cleveland. I really want to push that. Let me put this picture back up here so you guys can see it. So this is the book.
Yeah, that
Peace be
comes out.
still.
Yeah, that comes out November 21st, and that also is available via. I'm sorry, no, I keep saying the 21st, November 16th via
Mm.
Amazon,
Okay.
but you can pre-order. It is available for pre-order, and it's about 250 pages, so much smaller than journal of than the City Called Heaven.
Mm-hmm.
But and if you haven't heard the album Peace Be Still, it's available on Spotify and YouTube, and It's just really it's live gospel music, but it wasn't always really joyous. There was a somber tone to this recording in some parts, and "Peace Be Still" is a beloved song, but it is just one of those things where you almost felt in the recording something was happening in that church that was
Mm-hmm.
different,
Mm-hmm.
and that's why it ended up selling almost 800,000 copies.
Wow.
And at the time, if a gospel record sold 50,000 copies, that was a big deal. Until Aretha Franklin's "Amazing Grace," which Reverend Cleveland had a part of,
Mm-hmm.
it was the biggest selling gospel album in history, with a
Mm-hmm.
church choir and James Cleveland.
Wow. It's just amazing, like just talking about him. I'm just thinking about all of the wonderful things that all of the projects, all of the people that he's helped and how he blessed us. I mean, he was just he was a gospel great.
Yeah.
And even though he's gone, his music is still relevant. I mean, we still love his music. I don't, there's just some songs that will just be with us forever. And that's just the way it is. And he's created a lot of them that that I can relate to. That's for sure. So, yes. So this one again is coming out in November. You can pre-order
And Amazon.
at Amazon. Okay. And my
Yeah.
daughter, the music director, just put the information in the feed. And this one is available now. Now, this one again, correct me if I'm wrong, Bob. This one is the one that has the 4 CDs
Yes.
and the book included. And so
Yes.
this is available now on Amazon. It's about almost $59-$60, right? Am I
Yeah.
right?
Yeah.
Okay.
And they most of the songs come right from the original tape, so the sound
Oh,
quality is beautiful. Yes. I want to say probably all but maybe a couple came from the original tapes. Maybe a first couple of them didn't, but the rest did. And so you get this real good sound quality. So if you're like me and you got all these scratchy records around the house that you play these old songs,
oh my
you
goodness.
kind of hear what it sounded like in mint condition.
Yeah, that was like when we were playing the albums and stuff. Remember the album sound? I like that sound. The
Yeah, that was a
album
very
sound.
warm sound. Yeah.
Mm-hmm, mm-hmm.
But Reverend Cleveland thought he would not be remembered. Interestingly enough, he thought, and thanks for that, absolutely. He was afraid he would be forgotten. So I don't think he'll ever be forgotten. He
No.
didn't have to worry about that.
Yes. Well, our time has come to an end again. You know what? I'm gonna have to have you on here for about an hour. We have just so much we can talk about. It goes too fast when you're here.
It does go fast. It sure does.
Yes.
Well, I appreciate being here. It's great. Always great to talk with you.
Yes, yes, yes. You're part of the FNL family, so I'm always bugging you every once in a while. I send you email, but yes, it's just a joy to have you here, and this is some great information. You're always giving us rich information about gospel history or something in the gospel arena. So we just really enjoy you when you come in. Thank you so much, Bob, for coming and telling us about the new project about Reverend James Cleveland.
Yes.
Yes, I really believe it's going to be a really good sale.
Thank you. Thank you. I appreciate
Yeah.
it. And Kat, thank you for having me on again. I always appreciate being here. And thank you for all you do to give somebody and give a lot of people something to do on Friday night. Here we are, hunkered down for COVID, but we can turn on the screen and there you are, and you're providing information, education, and
Thank you.
entertainment and everything. And that's awesome. Thank you for that.
Yes, sir. Thank you so much. And thank you so much for the encouragement. So you take care of yourself. It's
Mhm.
fall now. I know it's cool up there in the Windy City. And, I'll be harassing you again probably in another 6 months because I know you have another project by then.
Right, I probably will.
Okay.
Well,
You
thank
take
you.
care.
Thank
You
you, Kat.
take care,
You
Bob.
too. Bye
All
bye.
right. Bye bye. OMG, y'all. OMG. Did you all enjoy that? I have to do a station identification. Yes, sir. That was Bob Marovich. Did you all enjoy that? All right. Coming up next, I have my friend. I've known him and his wife over 20 years. Can you believe that? Dr. Ronald Rembert Jr. He is a family medicine doctor in the Chicagoland area, and he has been practicing for 20 years, probably more than that. So please welcome to Friday Night Live, Dr. Ronald Rembert Jr. Okay, now where he at? There he is. Hey,
Hello, how are you?
doing well. How you doing, Doc?
Oh, good, Kat. Good to see you.
You too. You too. I have to do before we get started. Ron, can I do? Let me put the trivia question up there so they can think about it. Okay, because I gotta give
Okay.
this book away a little bit later. Okay, so here's the question. Don't tell the answer. How many Grammys did Reverend James Cleveland win? 4, 7, or 10? Did he win? Not got nominated for. Did he win? Okay, so we'll come back a little bit later. All right, so I am just so excited to have you. You supposed to be on last week, but somebody had happy anniversary. Oh, uh-huh. And then so you just left us in the cold, and y'all just went on had a good old time, didn't you?
Yeah, we enjoyed ourselves. We definitely enjoyed ourselves, but appreciate the invitation back and
Yes.
just looking forward to a lively conversation this evening.
Oh, you know what? Well, we got to show these pictures, y'all. I'm messy. Let me show you. Let me show y'all these pictures of Ron and Gay Nail. Let me see what I do with them. They are. I just had them. Oh, here they go. You got to tell us about these pictures. It's 19 years, right?
19 years, yep. That's
Okay.
it. So, Gaynell bought us some tickets to the Chicago Jazz Getaway that was hosted by Brian Culbertson. Fantastic job that they did down at the, now I'm blanking on the name of the hotel, but it was in Chicago,
Mhm.
uh, the Fairmont. And it was just a fantastic time. But I had an opportunity to take her to the signature room on the 95th floor of the Hancock building. So that's the picture that you see
Ooh,
on the right. Um,
that's beautiful.
Also, that's us with a couple of friends at the Chicago Jazz Getaway. And then on Sunday, took the family downtown to brunch and we went to Navy Pier. So that's us standing on Navy Pier as a family taking a picture with the skyline of Chicago in the background.
Wow. These are some beautiful pictures. I can tell you all the way up high. They go Lake Michigan. Now I'm a little homesick.
Yeah.
Wow.
Well, when you're looking at clouds at eye level, you're sitting up pretty high. I'm like, God forbid you got to run down them stairs. It's like, woo.
Yes,
Three
sir.
hours later, you come down the stairs, a puddle of sweat. Like, okay, well, that's some exercise. Definitely
Yes,
some
sir.
exercise.
Well, happy anniversary to you and Gaynell. You are one of my favorite power couples. Yes, you are. And many, many more.
Thank you.
All right, so
Awesome.
let's get to business. I know we got to talk about some serious stuff, so I'm going to follow your lead. Go
Okay.
right ahead, Doc.
Well, last week on September 18th, it was National HIV/AIDS and Aging Awareness Day. And that's when I was supposed to be broadcasting, but we'll go ahead and talk about it now. Basically, this day is to celebrate those who had contracted HIV or AIDS. And now we're seeing people living longer and longer lives with the disease. So this is to celebrate those who are 50 or older who now are being treated. And HIV now is looked at almost as a chronic illness now. I'll get more into detail as we continue with the conversation, but I mean, I remember seeing patients back in the 90s and 2000s and onward, just as the antiretroviral therapies were being developed and more effective treatments were
Mm-hmm.
coming about, we started seeing HIV turn from a death sentence into a disease that, although there is no cure, it can be managed medically, along with making sure they have proper diet, exercise, and just lifestyle changes, protecting themselves. So I'll talk a little bit more about that, but we are seeing people living longer and longer lives with HIV.
All right. All right. Well, I'm going to open it up for questions, but I'm going to wait till you finish your presentation or like whatever you talk about. And then if anybody has questions while Dr. Rembert is talking, please put it in the comments and we will try to get to as many as we can tonight. All right. Sorry about that, Doctor.
No worries. So,
Okay.
what is HIV? HIV is the human immunodeficiency virus. This virus attacks your immune system, and if it's not treated, it can lead to the acquired immunodeficiency syndrome or AIDS. That's where the virus destroys part of your immune system called the T cells that are responsible for helping you to fight off infections. And
Mm-hmm.
when that happens, you can develop infections that typically our bodies can fight off, but these infections can now be fatal depending on how badly your immune system has been affected by this virus. Now, it's been reported that the virus came from a similar virus called simian immunodeficiency virus that will start to be passed to humans when human beings hunted chimpanzees for meat and came into contact with their infected blood. And we saw this spread reportedly from Africa to other parts of the world. Now, to find out if you have HIV, you have to get tested. There are several types of tests that can be done, including nucleic acid testing, which is typically a blood test, antigen antibody tests drawn from blood as well, or antibody testing that can be done from blood or with saliva as well. Urine testing can also be done as well. But typically with that testing, you don't find out right away after you've been exposed whether or not you have HIV. It typically takes more than 72 hours. And in that period where there may be concern that someone has been exposed to HIV, you can take medications called post-exposure prophylaxis, but you have to talk to your provider. And with that being said, let me give this disclaimer. Any information that I'm sharing with you this evening is basically information not intended to treat or cure any disease. I want you to seek professional guidance from your physician, your medical provider, and if it's an emergency, please call 911 so that you can be treated emergently. So with that being said, let me continue. So with these tests that are being done, it typically takes, beyond 72 hours. Sometimes it could take a week or more before you can find out the testing results. But with the rapid tests, you can find out the results typically within 30 minutes or so. Now, some of the symptoms that you may see associated with HIV, some people can have flu-like symptoms that develop within 2 to 4 weeks after they've been infected. And these symptoms can last for a few days or several weeks. These symptoms include fever, chills, rash, night sweats, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. But some people may not have symptoms at all. And just because they don't have symptoms does not necessarily mean that they're not infected or cannot transfer the disease to someone else. Now, there are 3 main stages of HIV. The acute infection, in which the people who are infected have a large amount of that HIV, the virus in their blood, and they're very contagious. They may have flu-like symptoms like the ones I just described, and this is their body's natural response to the infection, trying to mount an immune response to fight off the virus. Some people may not have symptoms at all. Now, if you think you've been exposed, we definitely want you to go and get tested, seek out medical care, and once tested, follow up on those results to see what the next steps would be. The second stage of the infection is a chronic HIV infection. This stage of the infection may be asymptomatic or considered clinically latent. Fancy term for, basically the person doesn't have any clinical signs of the infection, but the virus is still active and is still reproducing in their blood, in their immune system at very low levels, and they may not have any symptoms at this time. But typically during this time, this is when we want people to be treated. And as I mentioned, the medications that are available now are very effective in reducing that viral load in your bloodstream so that people can live longer and longer lives. But you can still transmit HIV during this stage of the infection. And basically, we're monitoring the amount of HIV virus in your blood. This is called the viral load. And when we're looking at the viral load, we're also looking at a part of your immune system called the CD4 cell count, because that lets us know how well your immune system is staying intact. So a lot of times when that virus level goes up, it attacks those CD4 cells that help to fight off infection, and we see that CD4 count decrease. When the viral load becomes lower and lower and lower, typically we see those CD4 cell counts increase. And when we're treating patients with HIV with medications, many times they don't move into that third stage, which is the acquired immunodeficiency syndrome. Now, this is the most severe phase of HIV infection, and people with AIDS have such badly damaged immune system that they're at risk for a number of severe illnesses. These are called opportunistic infections. Diseases such as cancer called Kaposi sarcoma, atypical pneumonia called pneumocystis carinii pneumonia, and other infections that we typically don't see in people whose immune systems are intact. Now, people receive this diagnosis of AIDS when their CD4 count drops below 200 cells per millimeter, or if they have these particular opportunistic infections. They also typically have a higher viral load and can be very infectious. Now, without treatment, people with AIDS typically survive approximately 3 years or so. That's not always the case. And in many cases, if they're treated effectively, we can see that viral load decrease, and the recovery of their CD4 count may not recover fully, but at the same time, it can recover to the point where they're no longer considered to have AIDS and their immune system is intact and they're able to fight off infections more effectively.
All right. Do you want to take a break for a second? I got to play a video of you. And then after that, you want to talk some more, or you want to take questions? However you want to do it, we can.
We can take questions for a little bit. I want to see, what questions are available, and then we can kind of go from there.
Okay. Did you want to talk about aging a little bit?
Yeah, when we come back, that'll be fine, and then we could take some questions from there. But definitely, we can talk about aging.
Okay, you all check this video out.
Grandma's hands clapped in church on Sunday morning. Grandma's hands played a tambourine so well. Grandma's hands used to issue out a warning. She'd say, "Ronnie, don't you run so fast. Might fall on a piece of glass. There might be snakes there in that grass." Grandma's hands. Grandma's hands soothe the local unwed mother. Grandma's hands used to ache sometimes and swell. Grandma's hands used to lift her face and tell her, she'd say, "Baby, Grandma understands that you really love that woman. Put yourself in Jesus' hands." Grandma's hands. Grandma's hands used to hand me a piece of candy. Grandma's hands picked me up each time I fell. Grandma's hands, boy, they really came in handy. She'd say, "Anna, don't you whip that boy. What you wanna spank him for? He didn't drop no apple core, but I don't have Grandma anymore. When I get to heaven, I'll look for Grandma's hands."
Yes, sir. Yes, sir. Yes, sir. Yeah, y'all didn't know that I got a doctor and a magnificent saxophonist singer with me. Yes, there's many areas of Dr. Ronald Rembert. Yes, it is. Grandma's Hands. That's a beautiful song, and I think it's befitting right now. I'm hoping my grandma is listening. All right. So did you want to take some questions, or you want to talk about aging? I got a few questions right now.
Yeah, let's see the questions first, and then we can talk a little bit about aging.
Okay. The first question I saw on here was, how does AIDS, HIV compare with or relate to COVID-19?
That's an excellent question. AIDS or HIV, actually, they're both viruses, but the thing is, HIV is typically transmitted either sexually or through the blood. It can also be transmitted to a baby from its mother through breast milk, whereas
Mhm.
COVID-19 is spread through respiratory secretions. When people cough and they release saliva, it's spread. And the thing is HIV typically it takes a while to develop because as the virus continues to divide in your bloodstream, it starts destroying those CD4 cells in your immune system. COVID-19, once it gets into your respiratory tract, it can get into your lungs, but it can also spread into other areas of your body. But it can also cause, and this is where we've seen a lot of, the illness associated with it. It can cause an increase in the inflammatory state. Basically, fancy term for it increases your risk for blood clots, strokes, and other complications associated with it, along with as the virus continues to spread in your airways, can lead to difficulty breathing, decreased oxygen intake in your lungs. And over a period of time, many people have died from respiratory failure. There are also people who've died from other associated complications with it as well. I've seen people with blood clots, people developing strokes, blood clots in their lungs that could potentially be fatal as well. So the COVID-19 is far more virulent, fancy term for it spreads far quicker than HIV does. And because it's spread via respiratory droplets as opposed to through blood, semen, breast milk, we're seeing it spread on a worldwide basis, not like anything we've seen before. Well, we saw the Spanish flu in 1918 where we saw similar effects, but that was also a respiratory virus that was being spread. And we saw widespread, damage, widespread deaths and illnesses associated with that as well.
Yeah, that COVID-19, it seems like it takes you out quick. I mean, it's like it can be a quick thing. I mean, it's affected a whole lot of families within the last year. And wow, I never thought I would have saw anything like this in my lifetime, just being honest. Okay,
Yeah,
here's
I agree.
another question.
Absolutely agree.
Is it true that HIV medication can treat COVID-19? Have you heard that?
HIV medication can treat COVID. Um, Not that I know. I mean, it depends on what the medication is being used for. Typically, medications used to treat COVID are supportive treatments because there's no cure. There's a vaccine that helps your own immune system to fight off the virus, so you have less risk of contracting the virus. But just like with HIV, with COVID-19, there is no cure. We've used medications like remdesivir that can help to reduce like the virus from spreading and being as virulent or as strong in your body. We've also used steroids to reduce the inflammation, supplemental oxygen. I mean, there are different therapies that are being used now to combat COVID. But the main thing, and this is something I emphasize with people on a regular basis and have spoken to various groups and various people about, emphasizing getting vaccinated against COVID-19. The vaccination by far is most effective. And even for those who've been vaccinated and that we've seen potentially contracting COVID, typically it's milder and we don't see the complications that we see in those who contract COVID-19 who have not been vaccinated.
Okay. I think that's all of the questions on that. So let's talk a little bit about aging. We're getting close to the end of the hour, but let's talk a little bit about aging and tell us how we can take better care of ourselves. Give us well, not remedies, but give us some suggestions on how to, I'm getting older. I mean, we were talking about AARP cards and all that other stuff when we were doing our sound check. So give us some good stuff. I have a couple of seniors on here. I have middle age, and then I have young people too. So got a nice little variety.
Okay. Well, yeah, we were talking about AARP cards, and yes, I do have an AARP card. So I know you were kind of laughing about that. Like, really? I'm like, yeah, I got one. Yeah, I do. But the thing is, and this is something I look at as being good and beneficial. We're seeing people in our society living longer and longer and longer lives. And with the advent of, not only medications and vaccines and other ways that we're approaching getting older, we're seeing people living longer and healthier lifestyles. But it's people conscientiously approaching aging. Now, as we age, several things take place. We see less variability in our heart response. Basically, our maximal heart rate is less than it was when we were younger. So we also see alterations in our circadian patterns. Basically, our sleep-wake cycle gets altered. And the physiologic reserves that we need to cope with different challenges, illnesses, these become less and less. These physiologic reserves basically is your ability for your body to bounce back when you get sick, when you get tired, basically for you to heal. So as we get older, we have less and less of that ability over time. We do see decrease in our functional bone marrow reserves. So with that happening, we see a delayed response to blood loss. So when we're bleeding, basically it takes longer for our body to make the blood cells to replace what was lost. And with the loss of blood cells, those blood cells carry oxygen. So what we see is associated hypoxia or decreased oxygen levels that may be associated with that as well. Our white blood cells, which are the cells that help fight off infection in our bodies, that function is impaired also. And then also those people who are older who may have to undergo chemotherapy for cancer or for other treatments, we also see toxicity that's increased where basically that bone marrow doesn't bounce back as quickly. So those people who are treated with those chemotherapy agents, basically it takes them longer to heal and they may have more side effects associated with it. Getting older, we also have increased risk of blood clots. So, and then also increase, platelet responsiveness. Platelets are the part of our blood that causes our blood to clot. So when we get a cut on our skin, we see the platelets come together to help form a clot to stop us from bleeding. As we get older, that those platelets can over respond, and basically we can have increased level of clotting factors that can lead to blood clots, that can lead to strokes, heart attacks, blood clots in the lung called pulmonary embolisms, pulmonary emboli that can cause us not only to have difficulty breathing, but can be potentially fatal. We also see alteration in the muscles. So we have altered contraction in the muscles and in our sphincter tone. Sphincters are part of the muscles that are responsible for closing off certain areas of our body. Like in our stomach, we have a sphincter that connects the esophagus, the tube that leads from the back of the throat down to the stomach. If that sphincter isn't working properly, you can have reflux, or when that acid comes up from the stomach into your esophagus. And we see that more and more commonly as we get older. We also see the sphincter tone affected in our bladders and bowels, where we see more and more incontinence, where people can't hold their urine or may not be able to hold their stool because that sphincter tone gets decreased as we age. We also have changes in our colon where we can have decreased motility or decreased movement. So we see more and more episodes of constipation because your colon isn't moving the waste through the way it used to. So with that happening, there can be over time an increased risk of colon cancer. We also see a decline in our renal function or our kidney function because over time our renal cells can wear out. And if they're not being replaced, over time the kidneys don't function as well. And with worsening kidney function, at some point we may need to have the hemodialysis or even a kidney transplant. We also see over time age-related changes in our brain where brain cells can begin to deteriorate over a period of time. And we see older people sometimes developing what's called dementia, where they can have changes sometimes in their mental status that may be associated with that. We also see impairment in our blood vessels. As I was talking about the change in the muscle, if our blood vessels aren't as flexible, it may be harder for blood to travel through there. And over a period of time, you can see increase in blood pressure and difficulty for blood flowing, especially to the legs and extremities, where sometimes you can have what's called venous stasis, where the blood's not flowing back to the heart the way that it should. And sometimes you can have changes in not only the veins or the vasculature, the the blood vessels, but you can also see skin changes sometimes associated with it that can sometimes lead to skin infections and difficulty walking, leg swelling, all of those things. We also see changes in our eyesight where we have age-related changes in the lens and the iris. We also see changes associated in our auditory system where we have decreased ability to hear at high frequencies. So it's difficulty for people to hear, especially in loud environments.
Yeah, they need the hearing aids and
Exactly. We see more and more older people over time developing hearing loss over a period of time. And then with that, the need for hearing aid, the need for glasses. And then,
glasses.
yeah, exactly. And then also sometimes we can see a loss of taste and smell that's associated with deterioration in the nerve function in the nerves that go to the nose and tongue. But typically it's that decrease in that sense of smell that can affect the person's taste as we age.
Dr. Rembert, we're getting close to the hour. If we go over a little bit, I know that you're busy. Is it okay? Because I have a few questions.
Yeah.
Is it okay?
Yeah.
Okay, so the first one, now we're talking about aging. Is a vegan diet better as you get older?
It can be, but it also depends on what you're eating. And it also depends on genetics. Like, good genes get passed down. You see people that live to be 100. Many times they can have kids that can live to be 100 because they have better genes. We don't have any control over that. But what we do have control over is, as you mentioned, diet, our exercise, our amount of sleep that we get, which allows our body to recuperate and rejuvenate, regenerate as we sleep, and just basically being conscious of how we age. We're understanding more and more about the aging process. So a vegan diet may be beneficial because a lot of times if you're eating a vegan diet, you're not eating as much processed food that may have chemicals in them that can potentially lead to increased inflammation or may even be cancerous depending on the type of food that's being eaten, especially some of the additives that are put in some of the foods that we eat.
That we don't know. Yeah, that's good.
Exactly.
Okay, what are your thoughts on probiotics and age?
I'm a big proponent of probiotics. Probiotics are basically good bacteria that live in our gut, or we have good bacteria that live in our gut, but probiotics help to replenish that good bacteria that can sometimes get done away with when we take antibiotics. Like if you have an infection and you take antibiotics, it can get rid of that good bacteria that lives in the gut that helps to break down foods, that also may be responsible for helping certain chemicals to be made and also to help with digestion. I'm a big proponent of probiotics and I actually take probiotics daily. And I actually was reading about this, but had nutritionists that I've worked with and doctors that I've worked with that were strong advocates for taking probiotics because the probiotics can not only help with that digestion, and as I was mentioning, as we get older, that digestive tract doesn't move things through as quickly. So we see more and more constipation. Those probiotics may help to break down that waste material so that it's easier for us to pass stool and also easier for us to digest foods.
Oh, wow. Okay. What brain sharpening exercises do you recommend?
Um, Now, there are studies showing that you can do various exercises, crossword puzzles, various stimulating activities where you're thinking and actively trying to continue learning that may help to sharpen your brain. Basically, I'm of the mindset you use it or you lose it. So I'm a big proponent of reading and reading every day. Um, Different hand-eye things like even playing video games like Tetris or other things like that may help. But exercise is a big thing that really helps not only sharpen your brain, but keeping your brain sharp, because as you exercise, you're increasing blood flow to the brain, you're increasing your circulation, and it can also help you to reduce and control potential excess calories or weight gain over a period of time as well. But by far, I think exercise would be the best brain sharpening exercise. And if you can get in some cardiovascular exercise, some strengthening exercises on a regular basis, honestly believe that that will help your brain far more than some of the other things that are being proposed.
Okay. Are vitamins recommended for over 50 better once you reach 50?
We recommend vitamins not just for people over 50, but a lot of times we recommend vitamins for younger adults as well as children, depending on what their diet is. Most people don't get enough nutrients in their diet, even if you're eating vegetables and fruits and eating a balanced diet for every meal. Many times we don't get all the nutrients in, and we may need vitamin supplementation to help with that.
Okay. I think there was one more. Oh, this had to do with the vaccination. What about children that can't get vaccinated? I think they're talking about COVID, the COVID-19.
Okay. Yeah. Well, right now, one of the pharmaceutical companies, Pfizer, submitted information to the Food and Drug Administration for emergency use authorization for the COVID-19 vaccine for children 5 to 11 years old. Currently, children 12 to 17 have been approved to receive that Pfizer vaccine, but younger than that, it hasn't been approved. So Pfizer has collected data and says they have sufficient data to submit to the FDA, which they're doing, so that kids as young as 5 years old can be vaccinated, hopefully in the near future. They submitted data all the way down to 6 months of age.
Oh, wow.
I haven't had a chance to look at all the data, but I was actually trying to get my son enrolled in Pfizer's trial to see if I could get him vaccinated, because currently he's 10 years old. And his sister's been vaccinated. I've been vaccinated. His mother's been vaccinated. And he wanted to get vaccinated as well because he saw us doing it. But the thing is currently those children are not eligible for the vaccine as of yet. Once the FDA looks at the data that's being submitted by Pfizer, their panels will look at it and make their recommendations on whether or not the vaccine will be approved for kids in that 5 to 11 age range. And hopefully that can take place before the end of the year.
Okay. Dr. Rembert, I think that's all of the questions. Do you have any final remarks? I think that's it. I got all of
Well,
them.
thank you. I appreciate you having me on the show. Always.
Anytime.
Great time. And just looking forward to future shows with you.
And
I
concert.
enjoyed, awesome.
Oh,
I
sorry.
enjoyed Bob Marovich. He's very informative. I didn't know all of that about James Cleveland. I actually attended the Gospel Workshop of America in the 90s. I used to be in a gospel choir when I was in college that we used to sing in various places. And we actually sang at the Gospel Music Workshop of America back in the day. So I was just like, I didn't know James Cleveland founded that. It's like, wow, it's amazing. He did a lot of things. So
Yeah, somebody's gonna win. Thank you, Chef D. Rogers. He said great information, Dr. Rembert.
thank you.
Yeah, that was really, somebody's gonna win that big Reverend James Cleveland packet tonight. It's like about $60. It has like 4 of the CDs in there and a booklet and everything. So they're just waiting. I already got the winner, I think. Yeah. So do you want to take us out? You know, you had did a acapella thing. I'm gonna let you do that just because we're talking about COVID and AIDS, HIV, aging, and just the way the world is now. I mean, just encourage us before you take us out.
Definitely.
Before we finish. Yeah, go ahead. Put me on the. Cheryl is sitting up there clapping. We just have a church, and I'm like, put me on the screen. Put me on the screen. Oh my gosh. Amazing Grace. Yes. You played that one. You took us to not church, but church. I said, he going in. He about to go in on that saxophone. That was oh my gosh. That was beautiful, beautiful, beautiful. Did you all enjoy Amazing Grace with Dr. Ronald Rembert? Yes, sir. Dr. Rembert, thank you, thank you, thank you, thank you so much for coming and hanging out with me. You know, every time I call on you, you're always available. You make yourself available and you come and give us rich information, or you come and bless us with your music. And I really appreciate you and your wife. I mean, we've known each other like I think it's been over. Has it been? I know it's been almost 20 years.
It's been a long time. Like,
I can
this is
barely hear
like
you. Wait a minute.
my
Let me
first
see.
message. I was like,
I can barely hear you, Ron. Let me see. You got your mic on? Is it me?
yeah, yeah. It's on. Can you hear me?
Yeah. Okay. Yeah. I hear you. Okay. Yeah. Yeah. It's been a long time. So just thank you. Thank you for your friendship. Thank you for being there and your encouragement. And just, I mean, you have been one of my big supporters and encouraged me to do this whole Friday Night Live thing. And I just really appreciate it. I don't take it for granted. You don't find great friends like that. It's very, you know what I'm saying? So I really appreciate that. Best wishes to you on your future endeavors. You know, I'll be probably talking to you next week, but best wishes on your future endeavors. Happy anniversary again to you and Ganelle. And I wish you two many, 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 many more.
Thank you.
Yes, sir.
Appreciate you having me on the show. Thanks everybody for tuning in. I appreciate it, and we appreciate it. And I mean, it's just God's amazing grace. I thank God every day that He saved me. We all need a savior. I don't care who you are, black, white, poor, rich, don't matter your background, what degrees and letters you got behind your name. We all
That's
need
right.
Jesus.
Amen.
And I thank God every day that I have a relationship with my Lord and Savior, Jesus Christ. So if you don't know Him, now's the time to get to know Him, especially in these days. We're seeing things becoming crazier and crazier and crazier.
Yes.
And it's just God's grace that keeps us.
Yes.
So thank you for this opportunity to share.
Yes, sir.
Yes, sir.
All right. You take care, Dr. Rembert.
You too. Thanks,
All right.
Kat.
Bye-bye. All right.
Be blessed. Take care.
Woo. Jazzy say the doors of the church are open. Yes, sir. Yes, sir. Oh wow, what a great show. What a great show. I hate to end them when they're good like this, but it's informative, but it's encouraging, and it's sometimes, you know, we just need that, just an uplift spiritually and just some encouragement. Send a shout out again to my auntie Ada. Did you all enjoy that? The song. I don't know if I know she's on now, but I don't know if she know that I played it. But did you all enjoy that earlier? The hymn she sang, beautiful, beautiful, beautiful. Then we got a chance to hear Grandma's Hands, Dr. Ronald Rembert. All right, well, let's see who won. Let's see who won. Well, first, where is the question? The question was. The questions. Can I get an eye? Pose. Wait. Okay. How many Grammys did Reverend James Cleveland win? The correct answer is A, number 4. He actually won 4 Grammys. All right. Who is our winner? Sure, you want to get on today, or you want to just give it to me?
I handed you the thing, Mama.
I lost it.
The winner is Chef Rogers.
Congratulations, Chef Rogers. Put me back on the screen, baby. Ron got us all messed up with that Amazing Grace. We pushing all kinds of buttons. Just that last song, Lord. Chef Rogers. Okay, so Chef Rogers, congratulations. What I need from you is your mailing address. So if you go on my Friday Night Live Facebook page, there is an inbox. If you would send me your mailing address, I'll send you that Reverend James Cleveland, and you gotta let me know how much you enjoy it. Yes, let me know how much you enjoy it. That's just really, really awesome. Sure, you want to give a few shout outs? I saw the Stamp Keeper on here tonight. Hey, Charlene. I saw Lady Jackson. I saw Portland Ward. I can't see. Okay, so is the stream a little bit better? We have upgraded. I had to upgrade the computers. I'm gonna send you all next time. We'll take a picture so you all can see the new studio. But we had to upgrade because everything started freezing, and the equipment that I had bought a year ago just was not handling all of the information and all of the videos and stuff. So we have updated. We have new screens. We have a new brain that changes colors. I'm just so excited. And so yeah, so we'll send pictures. We'll show you all next week. But I can't see. You got to give the shout outs because I can't see. Cheryl is all the way on the other end of but we got to give our shout outs. Give our shout outs.
All right, we got, let's see. We have.
And you should get on the screen with me, She's so far away now to me, it seems like.
Let's see. We have Bonnie Wilson. Hi, Bonnie Wilson. It's so good to see you on YouTube as well as Illumination Kingdom Teachings. You guys are always holding it down as well. Walter Williams, I guess, transferred over to YouTube with us instead of Facebook. It's good to see you over here as well. Welcome. On Facebook, we had a bunch of people. Facebook, like not even joking. We had, let's see, Jazzy K Ward. Thanks for stopping by,
Jazzy.
We hope you enjoyed. We also have Miss Tina Wilson stepping in. Hey, Miss Tina. We got Mother DeBose. Good to see you. We also had Miss Lady Jackson up in here. Happy Friday. We have Pastor Neil. It's good to see you as well. And we had Ronald Rembert in here holding it down while Ron.
That's his wife, yeah.
While Dr. Ronald Rembert was giving us some good old information and just touching our hearts with that music.
Yes, he did. Yes, he did.
And then we have Miss Sherry Johnson. Hey, Sherry.
Hey, Evangelist. Yay.
Hi. It's so good to see you. We have Portland Nisi Ward up in here. Hey, Portland. Virginia Mobley. Hi.
Evangelist Mobley.
Hi. Let's see. Auntie T. We got T Cradle in the house.
Hey, sister.
We got...
you all make sure y'all go back and listen to my Auntie Ada if y'all missed it at the beginning of the show. Y'all got to hear that.
Do you want to close out with it, Mama?
Can we?
If you want to.
If they'll hang, we can close out with Auntie Ada.
Yeah, we can.
Yes. I'll let you finish your shout outs.
We got it already set up. We got Chef Rogers up in here. Hey, Chef. Congratulations on that package, and we hope you enjoy. You got to let us know how you like it.
Yeah, that's going to be a nice one.
We have Miss Charlene, the Stamp Keeper. Blair up in here, the Stamp Queen Collector.
Yes,
she is.
She is doing some great things too. I got to get her back on here.
I can't wait to see what new stuff she has. We have also Miss Deborah Pitts. Hi, Deborah.
Sister Pitts.
So good to see you. We got Olga. Hey, Olga.
That's my scientist friend.
She's stepping in here. We don't see her that much, but when we do, she's always smiles.
She's busy, but she gets on sometimes.
Yeah, Auntie Sally up in here. Hey, Auntie Sally. Mwah. Good to see you. Auntie Ada, hi as well. Mwah.
Y'all want to hear Auntie Ada sing on the way out? Take y'all. Send me some hearts. I'll do it if they put some hearts on there. I'll put Auntie Ada on there again.
Oh, we got Pastor Leslie Lee up in here. Hi.
Memphis Metro and Memphis Pastor Pat Lee. Yeah, Patrick P Matt. Oh my God, I didn't. Matthew Lee, excuse me.
It's okay.
Everything just went blank.
It's okay.
Matthew Lee, Pastor Matthew Lee.
We have, that's probably, actually, I think that's it.
All right, you all send me hearts, and I'll play that song one more time.
We got hearts. We've got
hearts
from Olga. We got some hearts from Jazzy. We getting hearts from
all right.
everybody.
Well, this is gonna take you all out. Yes, we're gonna take you all out. Have a great week. Lord willing, we will.
I need mouse.
Oh, she needs the mouse. Here's the mouse. Sorry. Lord willing, we will see you all next week. Next week, my church, the women, we're having our women's conference this weekend. I'm really excited about that release. I'm not sure if the link is available for everybody to see, but if you go to the Mount Joy Facebook page, I'm not sure. It may be available for all to see. I'm not sure, but hopefully it'll be, if not, it'll be on a little bit later, but I'm really excited about that. I'm really excited about what I have a spirit of expectancy for me and the ladies. We've been through quite a bit, and I believe that we're going to be blessed this weekend. Got some of my committee members on here with me. You all are amazing. I just love y'all. Okay. All right. So we're going to play Auntie Ada.
Mm-hmm.
I think you're playing Dr. Rembert. All right. On me shine on me. I wonder if the lighthouse will shine on me, shine on me, shine on me. I wonder if the lighthouse will shine on me. I heard the voice of Jesus saying, come on to me and rest, lie down, thy weary one, lie down, thy head upon shine on me. Shine on me. I wonder if the lighthouse will shine on me. Shine on me. Shine on me. I wonder if the lighthouse will shine